All rise.
I know.
Thank you. You may be seated. Counsel, your next witness.
Your Honor, good morning. The people called Dr. Nicole Fracticelli to the witness stand.
Please raise your right hand. Do you swear or affirm the testimony you're about to provide will be the truth, whole truth, nothing but the truth, and nothing but perjury? Thank you. Stand there and have a seat. Pull the chair right up to the microphone. Feel free to adjust it so you can speak comfortably into it. And then when you're ready, please state and spell your name for the record.
Nicole Fraticelli, Nicole
Juror 7, can you hear her? Clearly loud?
Yes.
All right, just don't be any softer than that. All right, thank you. You may proceed, counsel.
Thank you, Your Honor. Good morning, doctor.
Morning.
Doctor, where are you employed?
I'm employed at University of Michigan Health at Sparrow Hospital.
In what capacity are you currently employed at University of Michigan Sparrow Health System in Lansing?
I work for the orthopedic trauma surgery team.
How long have you been so employed as a physician connected to Sparrow Medical Group in Ingham County, Michigan?
I worked there since 2021, and before that I was a resident since 2016.
Doctor, can you tell the jury, please, what is your exact medical specialty, please?
Orthopedic surgery with emphasis in orthopedic trauma.
Can you tell the jury first, what is an orthopedic surgeon?
We perform surgeries for broken bones, joint replacements, tendon repairs, knee shoulder scopes.
So in simplest terms, you're a surgeon.
Yes,
All right. How long have you been an orthopedic surgeon in the manner you just described?
since 2021.
I want to talk a little bit about your educational background, doctor. What is your educational background? First, where did you do your undergraduate studies?
I went to undergraduate in Springfield, Missouri at Evangel University.
And what, if anything, did you obtain a degree in at Evangelical University?
Bachelor's in biology.
And did you go to medical school after that?
Yes.
Where did you go to medical school?
To A.T. Still University in Kirksville, Missouri.
And what type of a degree did you get from medical school?
Doctor of osteopathy.
After medical school, doctor, did you do a medical residency?
Yes.
And what is a medical residency?
It's a dedicated variable amount of time. My residency was 5 years and specialized in orthopedic surgery.
Where did you do your medical residency in orthopedic surgery?
I did it in Lansing at McLaren Greater Lansing Hospital.
And you indicated that your medical residency in orthopedic surgery was 5 years.
Yes.
Can you tell the jury, please, what is a fellowship program?
Fellowship is an extra year that you spend after residency, further subspecializing in a procedures, or mine was in trauma.
Did you do a fellowship program?
I did an unaccredited fellowship, yes,
And where did you do your fellowship program?
at Sparrow Hospital.
Can you tell the jury, please, what was the specialty area that you focused on in your fellowship training?
Orthopedic trauma.
What is the difference between orthopedic trauma and orthopedic surgery, or how do those two work together?
So orthopedic trauma mainly deals with injuries involving musculoskeletal system that happen acutely, usually fractures or gunshots or stabbings, that sort of thing.
What are your current job duties with U of M Sparrow Hospital?
I work for coverage for the emergency room and take patients down to surgery that need orthopedic care on an urgent basis.
Do you only do orthopedic trauma now, or do you also do just general orthopedic surgery practice?
I'm only doing orthopedic trauma.
All right. I want to talk a little bit about something called the orthopedic trauma team that you referenced when you began your testimony. What is the orthopedic trauma team?
It's myself and my partner, two orthopedic trauma surgeons, and we have two orthopedic physician assistants. And we also work with several orthopedic residents who help assist us in seeing consults in a timely manner and assisting us during the surgeries.
Under what circumstances is the orthopedic trauma team activated at Sparrow Hospital?
Whenever the general surgery trauma team responds to all traumas, identifies a fracture or a wound that is down into a joint, then the orthopedic trauma team is notified.
Are you on call, or is someone from your team on call 24 hours a day for orthopedic traumas that are brought into the Sparrow Hospital emergency room?
Yes,
How often are you actually on call as a member of the orthopedic trauma team?
I am on call about 8 to 10 times a month.
I'm sorry, I didn't hear your answer. Was it 8 to 10 times per month?
Yes,
That's okay, no problem. And is that a 24-hour call, doctor?
yes,
Okay. Doctor, in addition to your clinical work as an orthopedic trauma surgeon for Sparrow Hospital, do you also maintain a faculty position somewhere?
yes, at Michigan State University.
Do you work at the undergraduate level, or do you work in the College of Osteopathic Medicine at Michigan State University?
College of Osteopathic Medicine.
How long have you been on the faculty of Michigan State University College of Osteopathic Medicine?
Since 2016.
And what do you teach, or what areas do you teach at Michigan State University Medical School?
I oversee medical residents at the hospital that are rotating through our department.
Are you familiar with something called the American Academy of Orthopedic Surgeons?
Yes.
And what is that professional affiliation?
What is the question?
What is that professional affiliate, or what is that professional organization, the American Academy of Orthopedic Surgeons?
It's a group of all the orthopedic surgeons that are approved in the United States.
And are you a member of the American Academy of Orthopedic Surgeons?
Yes.
Doctor, are you currently licensed to practice medicine in the state of Michigan?
Yes.
Your Honor, at this time, pursuant to MRE 702, the people would move to qualify Dr. Nicole Fracticelli. She's an expert. She's a physician specializing in the area of orthopedic trauma surgery.
Any objection or voir dire?
No, Your Honor.
She is so qualified.
Thank you, Your Honor. Doctor, I want to direct your attention to just over a year ago to the early morning hours of July 7th of 2024. Were you so employed as a member of the orthopedic trauma team at Sparrow Hospital on that day, Doctor?
Yes.
Were you working or on call in the early morning hours of July 7th, 2024?
I was on call.
And when you're on call, I assume that means you're home at your house in the middle of the night?
Yes.
All right. Did there come a time when you were contacted regarding an orthopedic trauma case that had been presented into the Sparrow Hospital emergency room?
Yes.
And what type of a trauma case was that you were contacted about?
My orthopedic resident called me and notified me that they had a gunshot victim that was brought in just shortly before the phone call.
And what was that patient's name, please?
Miles Washington.
After you were contacted by the orthopedic resident, did you then go to the Sparrow Hospital emergency room, doctor?
Yes, I went later that morning.
And did you have contact with this individual identified as Miles Washington?
Yes,
Where did you have contact with this patient, Miles Washington?
in the preoperative unit.
The preoperative unit, is that a different location than the emergency room area?
Yes.
How are persons, or why are persons transferred from emergency room to the preoperative area?
Once they have been approved to have surgery by the emergency physician, then they are taken to the preoperative unit holding area. And then the surgeon will come see them, and then we will take them over to the operating room.
All right. Doctor, I want to talk about something that's termed medical terms, a chief complaint. Can you describe for us in specific terms, what was the chief complaint that Miles Washington presented with at the Sparrow Hospital emergency room that night?
Gunshot wounds to his bilateral legs.
When you say to bilateral leg, does that mean to both of his legs?
Yes.
And was this individual in acute distress when he was presented to the emergency room as a result of those bilateral gunshot wounds to his legs?
That is what the record states, yes.
All right. Doctor, understanding that Mr. Washington had been treated in the emergency room that night, why was it necessary to activate the orthopedic trauma team that evening?
He had a gunshot to the left knee with a retained bullet fragment within the knee joint, based off of the CT scan and the X-ray.
Based on that injury, it was determined that an orthopedic trauma, at a minimum, consult needed to occur that night, doctor?
Yes,
All right. I want to digress for a moment. Is it standard procedure when patients are brought into the Sparrow Hospital that a medical report is generated?
yes,
And are you required as a physician to document your findings, your diagnosis, your treatment in a medical report?
yes,
And are you required to report accurate information in your medical report?
yes,
And doctor, do you do that in every case that you treat at Sparrow Hospital as a member of the orthopedic trauma team?
yes.
Doctor, I'm handing in my hand here, holding in my hand here, People's Proposed Exhibit number 55. Did you have an opportunity to review this prior to your testimony here today?
Yes,
And this document, People's Exhibit number 55, is this a representation of a medical chart that was generated based upon your care and treatment of this patient, Miles Washington, on July 7th, 2024?
yes,
And this would be accurate information that is placed inside this report. Is that correct?
yes,
Your Honor, at this time, pursuant to MRE 8036 and 90211, the people move admission of People's Proposed 55, which are medical reports in this case.
Any objection or voir dire?
Well, I'm not objecting to foundation, Your Honor. However, I think it would likely be duplicative to what the witness would and could testify to, so I think it could be considered cumulative.
Thank you. The standard for cumulative evidence is that the unfair prejudice would substantially outweigh the probative value. And in this case, Your Honor, as it relates specifically to medical reports, the standard is, does the additional information make the testimony of the witness clear? Okay. And there's also case law, Your Honor, that suggests that an expert does not have to be limited solely to their testimony, and that you can use documentary evidence, photographs, etc., even about items that the doctor is explaining to make the testimony clearer. So that on that basis, we would move for admission. It is relevant and not cumulative.
I find it's relevant, not cumulative. 55 is admitted. Thank you.
Thank you, Your Honor. All right, so doctor, did you personally conduct a physical examination of this patient, Miles Washington, in the preoperative area?
yes,
I want to talk a little bit about the times in this case, and I want to refer to your medical chart, please. And I want to talk a little bit about admission date and time. So it looks like he was admitted into the hospital July 7th, 2024. Is that correct?
yeah,
And what time was the time of admission into Sparrow Hospital?
3:46 a.m.
All right. And what time, doctor, did you have contact with Mr. Washington in the preoperative area of the hospital that night?
Well, this is the note that the resident wrote at 5:19 a.m. So I contacted the patient around 9 a.m.
About 9 a.m. Okay. So you would have made contact with him approximately 5.5 hours or so after he was admitted into the hospital that morning, doctor?
Yes,
Okay. Was a medical history taken in connection with Mr. Washington's admission into the hospital?
yes.
Doctor, what is a medical history?
Any past illnesses or conditions that the patient has?
And is it important to take a medical history in the case?
Yes.
Why is medical history important for you as a physician when treating the patient, doctor?
To know if there's any complicating factors in the current chief complaint that I'm treating?
All right, was a medical treatment taken in connection with Mr. Washington's admission into the hospital that would have been memorialized in this medical report?
What's the question?
Sure, bad question. Was a medical history taken in connection with Mr. Washington's presentation into the hospital that night?
Yes, I believe so.
Okay. Now, I want to talk a little bit about that medical history. In the medical history here, it indicates that the patient notes bleeding and pain to the right upper thigh, left upper thigh, and left knee. Is that consistent with your observation of Mr. Washington when you did your physical examination?
Yes,
All right. Now, you indicated that the chief complaint in this case was multiple gunshot wounds, meaning bilateral gunshot wounds to the legs. Is that correct?
yes.
Can you tell us just in general terms, where were those gunshot wounds located on Mr. Washington's body?
There was one that came from his right side into the right thigh, came across outside, out of the left side of the right thigh. There's another shot into the right side of the left thigh, and then another wound on the left side of the left thigh. And there was a wound along the right side of the left knee and along the left side of the left knee.
All right, so we're gonna go into those a little bit more specifically. Thank you for that description. I want to talk about this concept of pain for a moment. Would pain be consistent with the finding of gunshot wounds bilaterally to the legs that Mr. Washington sustained?
Yes,
How painful would these injuries be? Pretty painful?
relatively painful, yes.
All right. How would you expect Mr. Washington's pain to be managed upon his initial presentation to the emergency room with gunshot wounds?
Usually they are given IV pain medication.
Right. Are you familiar, doctor, with the pain medication fentanyl?
Yes,
Can you tell us what fentanyl is, please?
it's an opioid narcotic medication.
Would fentanyl be an appropriate medication to manage pain on a patient like Mr. Washington who was presented into the emergency room that night?
Yes,
Showing you in your clinical note down here, doctor, this area here, it says current facility administered medications. Does that mean the medications that Mr. Washington was receiving after his presentation to the hospital that night?
yes, these are medications that were given between the admission and when the note was signed at
All right.
5 something.
So we see here this bottom entry here. Can you describe for us, please, what that entry is, medication he was prescribed at some point in time after his admission into the hospital?
He was given the pain medication fentanyl.
What does a sublimase mean?
That is the brand name,
Okay, and injection 50 to 100, what does that mean, please?
51 to 100 micrograms.
Would that be an appropriate or consistent dosage for the type of injury that Mr. Washington sustained?
Yes,
All right, so we look over to this column here, and this says last admin. Does that mean last time it was administered, doctor?
last time before the note was signed, yes.
All right. I'm just flipping the page over here. There is a time given for when Mr. Washington was last administered a dosage of fentanyl. What time was that last dosage of fentanyl administered to Mr. Washington, please?
4:05 a.m.
All right, so if he presented to the emergency room at 3:46 a.m. and was admitted, that would be about 20 minutes after he was admitted into the hospital. He was given the opioid fentanyl, is that correct?
Yes,
All right, and that's something you might expect under the circumstances of how he presented, is that accurate?
yes,
Okay, thank you. All right, now I want to talk about your personal examination. And we talked about in general terms, and you gave me quite a bit of specific. I'm going to have you stand up if that's okay at some point and show the jury. I want to talk about your examination of his right leg, okay? And you told us that you observed gunshot wounds to the area of his right leg. Is that accurate?
yes.
Would you mind, doctor, I don't want to make you uncomfortable. Would you mind standing up, please, and showing the jury, just pointing on your own body as to where the gunshot wound you observed was on his right leg?
I observed it right on the lateral side of the right thigh,
Could you please turn and face the jury on that side? Thank you.
not right here.
Can everyone see? If not, please stand. All right. All heads shaking yes.
All right, thank you. So on the, what I'm going to call for the record, because we can't take a picture of you, the outside surface of his right upper thigh, is that correct?
Yes,
That, did you believe that to be the entrance or exit wound site of that injury?
From what I could tell, yes.
You believe it to be the entrance or exit, which one?
The entrance.
Okay. Did that projectile in his right leg stay in his body or did it exit his body?
I believe it passed through the right thigh, came out the inside portion of the right thigh.
And was there a projectile located in the body as it relates to that injury to the right leg?
No.
Okay. Now I want to talk about the left leg. You did examine his left leg, is that correct?
Yes,
I want to talk about the upper area of his left leg. Did you observe an additional gunshot wound in the upper area of his left leg?
yes.
Can you point to the jury where that entrance site was on that gunshot wound, please?
It was right here.
Okay, so for the record, pointing to the inside of your left thigh, is that correct?
Yes,
Did that projectile stay in the body or did it exit?
it exited
Can you show the jury on your own body where it exited, please?
over here.
Okay, you're pointing to the backside of your left thigh, is that correct?
Yes,
And did the jury see both heads shaking? Yes, you may proceed.
Thank you. And that projectile, assumed, did not stay in the body, is that correct?
yes,
So we have 2 through and through gunshot wounds, one to the right thigh, one to the left thigh. Is that accurate?
yes.
All right, thank you, doctor. Just for the moment, sit down. I'm going to make you uncomfortable again in a moment by standing up. I want to talk a little bit about the wounds you just described. Doctor, what is your diagnosis as to whether those gunshots that you just described represent 2 independent gunshot wounds or whether they represent 1 continuous gunshot wound?
I believe there was one continuous gunshot wound based off of the fact that I extracted denim material from the inside of the left thigh, which wouldn't have occurred if it was in like 2 separate gunshot wounds. I believe the denim was from the inside of the right thigh as it crossed over to the left thigh.
All right. And was it your opinion, doctor, that the gunshot wound that went through his body, through both legs, it emanated from the right side of his body? Is that your opinion,
That's
doctor?
what I believe.
All right.
So the bullet goes through, it collects, punctures a hole in the jeans and then keeps that jean material, in this case, through the body?
Mhm.
Oh, okay, just want to make sure I have the picture right, thank you. And that's a yes.
Yes,
All right, doctor, so we're at the point in time in your testimony where you've indicated there were 2 separate entrance and exit sites, but you believe they were from 1 right-sided gunshot wound. Is that all accurate, doctor?
Yes.
All right, thank you. So I want to talk about the next gunshot injury that you observed to his lower leg and knee area. Last time, to make you uncomfortable, could you stand up for the jury, please, and show us on your own body where the entrance site of that gunshot wound was, please?
here on the lower left thigh.
Can everyone see, please stand? Yeah. Yeah, all right, thank you. Now everyone has nodded their head yes.
So for the record, you're showing the lower inside of the left knee or the right side of the left knee. Is that correct? All right,
Right side of the left knee, yes.
right side of the left knee, if that makes sense. Now, that particular projectile, did it exit the body or did it remain in the body?
Partially was retained, partially exited.
Can you point for us on your own body where it did partially exit in the body?
Over here.
So for the record, you're on the outside or the left side of the left knee, is that correct?
Yes.
All right, thank you, doctor. No more demonstrations.
What does partially mean?
Well, I'm gonna get to that, Your Honor.
All right.
Thank you.
Yeah.
All right. Before I get to that, let me just ask you a couple foundational questions. In addition to your own personal observations that you made, were diagnostic tests done like x-rays or CT scans?
Yes.
And what, if anything, did those diagnostic tests show as it relates to the knee injury that you just described for us?
There was a cortical fracture along the front side of the left femur with retained bullet fragments.
All right, so when you talk about partially exiting the body, what does that mean, please?
Means that the bullet fragmented and some of it left the body and some of it was retained within the knee joint.
All right, does that answer your question, Your Honor, I hope?
Yes, and what is a cortical fracture? Is that what you said?
Yes, so the outside portion of the bone is called the cortex. And so there was a divot taken out on the front side of the bone from part of the bullet fragment.
Thank you.
All right, so you just got to my next question, describing what a cortical fracture is. And so we have a cortical fracture, and then we also have a portion or fragment of the bullet that remains in the knee joint, correct?
Yes,
Tell us lastly, where exactly in the knee joint was that fragment located, please?
it was in the left suprapatellar pouch.
All right, and is that in the knee joint itself, or where exactly is that?
Yes, it's within the knee capsule in the joint.
All right, and before I get to the treatment of that, doctor, I want to direct your attention to the medical chart here. There's something called a secondary survey. Can you tell us what is a secondary survey, please?
We do an initial survey examining the area of injury, and then the secondary survey is all the other body parts that we don't believe to be injured, but we want to double check to make sure that there's not something that we're missing.
Right, and in the secondary survey, it looks like it was documented that there were scattered abrasions present in the left shoulder and the left leg. Is that all accurate?
Yes.
Okay, thank you. All right, doctor, with that foundational background, I want to talk about the treatment, please. Can you tell the jury what, if any, surgical treatment was required for the gunshot wound injury to the first two continuous bullet wounds that went from the right to the left leg? Was any surgical intervention required there?
No,
Why not?
because it did not enter any organs, and it did not enter any bones or knee joints or hip joints.
All right, so understanding that, doctor, how are those wounds treated then if they're not repaired surgically?
Usually a washout and dressings placed in the emergency room.
All right. Now, with respect to the left knee, doctor, what, if any, surgical treatment was required for the gunshot wound to the lower left leg and knee that you just described for us?
There was, because of the big retained bullet fragment within the knee joint, it was required that we go and have surgery to wash all of that out and take out that remaining fragment.
Doctor, what are the potential medical complications involved in an injury where a bullet fragment is retained in the knee joint?
The joint capsule creates a fluid that bathes the retained fragment and can cause a toxic environment within the knee joint and cause what's called plumbism. It's lead toxicity within the knee, and that can develop arthritis and other systemic symptoms.
There are circumstances with gunshot wounds where fragments or actually bullets themselves are left in the human body. Is that correct?
Yes,
Apparently, this is not one of those circumstances. Is that accurate?
not at this location, you cannot leave it there.
Okay. If, for example, that fragment were left inside the body and those complications developed, what would be the likely result of those complications?
Anemia, seizures, have neurotoxic effects.
So pretty serious complications,
Yes,
even potentially life-threatening complications.
yes.
Can you tell the jury, please, how the surgery is performed and what's the general process that you go through?
Make an incision along the front side of the knee, and then we extend our incision through the deep level along the inside portion of the kneecap. We push the kneecap to the side, we wash out all of the joint surface, and then we take out any retained fragments that we find.
How long does this surgery last?
About an hour.
Once the surgery occurs, is the fragment removed?
Yes,
And is that fragment later kept for police if this is a case of a gunshot or a shooting?
yes,
In this particular case, was the surgery to Mr. Washington's leg a successful surgery to remove that fragment?
yes.
How was this injury treated post-operatively?
We placed a brace to help support the cortical fragment and the femur, the fracture, but then otherwise he was allowed to weight bear as tolerated.
Are there any potential post-operative risks with this procedure?
There's risks of infection, there's risks that the fracture wouldn't heal, there's risks of wound dehiscence where the incision splits back open.
With respect to post-operative restrictions, how weight-bearing would Mr. Washington have been after this surgery?
He was diminished for about 2 to 3 weeks, and then we were able to advance him.
After the surgery, did he have to remain hospitalized?
He remained hospitalized for IV antibiotics, which is normal after surgery for about 24 hours.
Was he required to follow up with you or anyone else after this surgical procedure?
Yes,
Who did he follow up with?
myself.
And did you actually see Mr. Washington?
Yes,
Did he recover appropriately and successfully from this operation that was performed to remove that fragment from his leg?
yes,
And in this particular case, the fragment that was removed, that was retained and saved for police for this investigation. Is that accurate, doctor?
yes.
All right. I want to talk a little bit about these injuries and how they would have affected him. Doctor, tell us, how would the gunshot wounds that Mr. Washington sustained, how would they have affected his ability to ambulate immediately after he received those injuries?
It would have made it difficult.
Could he walk, do you think, or move any distance, or would he have immediately collapsed to the ground, if you know?
I think due to the pain, he likely would not have been able to move very far, maybe a few feet.
How did the fracture that he sustained to his leg affect his ability to run, walk, or otherwise ambulate?
Severely limited.
We had testimony from police officers that Mr. Washington appeared to be in acute distress or in a lot of pain at the time immediately after he was shot. Would you believe that's consistent with the type of injuries that he sustained?
Yes.
We've also heard testimony that there was quite a bit of blood that was located on scene. Would that again be consistent with the type of gunshot wounds that he received in this particular case?
Yes.
Doctor, what if anything is the risk of shock that comes after sustaining a traumatic gunshot wound like this?
It's relatively high.
With respect to the two gunshot wounds that he sustained, or the one single gunshot wound that struck two legs, along the path of that gunshot wound, would his scrotum be very close to the path where that gunshot wound came?
Yes.
Would that be a risk that he would be struck in the scrotum area as a result of these gunshot wounds in his right thigh?
Yes.
In addition to that risk, doctor, can you tell us what are some of the potentially life-threatening complications associated with sustaining a gunshot wound to the thigh or leg?
Excessive amount of blood loss.
Are you familiar with either the femoral or the inguinal arteries in the leg?
Yes.
Okay, where do they run in a human body? Where are those located?
They run from the abdomen, the aorta splits and it runs along below the ilioinguinal ligament, and then it runs down the medial side of the thigh.
If a person is shot in the thighs or leg, is there a risk that either the femoral or the inguinal artery could be struck by that bullet?
Yes.
If that is the case, how serious an injury is that, being struck in either an inguinal or a femoral artery?
Life-threatening.
So is it possible a person could actually die as a result of being shot in the legs or thighs?
Yes.
And how long do you think it would take a person to die if they sustained that type of an injury without being treated quickly?
Probably about 10 minutes.
Doctor, thank you so much for being here. I have no further questions.
I have no questions for this witness, Your Honor. Thank you.
May this witness be released from subpoena?
Yes, Your Honor.
Thank you very much for your time. Please do not discuss your testimony with any other witness during the pendency of this matter. Have a nice day and a safe drive back. All right, we stand in recess until 2. We'll see you back at 2.
All rise.
Crazy, I know, we tried it. All right. So council, I just have some students I'm hearing, and then I have a doctor's appointment, then I'm coming back. So if you want to take your things, fine. If you want to leave them, the courtroom will be locked.